Here's my ID. Tammy Sullivan. The title of my article is The Effects of a Low Carbohydrate and Low Fat Diet. The journal the article comes from is called Annals of Internal Medicine, Volume 161, Issue 5, published on September 2nd, 2014. CVD, also known as cardiovascular disease, is the cause of 1/3 total deaths in the U.S., thus making this disease one of the most important public health challenges. Therefore, the design was a randomized parallel group trial study. It was created in order to see if there was a cause and effect relationship with a low-carb diet and low-fat diet to the reduction of CVD risk. Each and every person was chosen because they did not have any clinical CVD or diabetes, but were obese. Most of the participants were African American. Throughout the trial, data was collected such as alcohol consumption, smoking, blood pressure, cholesterol, and BMI, body mass index, etc. Those who were assigned the low-fat diet were to maintain less than 30% of their daily intake from total fat, and those with the low-carb diet were to maintain an intake of a digestible carbohydrate, which was the total carbohydrates minus their total intake of fiber. On a daily basis, each participant was ordered for a recall of their intake with a trained specialized staff member. Their activities and body weight were also recorded. In order to get the final result, the analysis needed at least 55 participants per group to provide any detection in weight change. There was a 25% dropout rate after the randomization, but still allowed just enough participants for the statistical analysis. After the trial of 12 months, each group's recorded data such as CRP levels and HDL cholesterol were recorded. The low-carb group came out on top to be the most healthiest, but serum levels of insulin and creatinine decreased significantly in both groups. Results: 148 men and women without clinical cardiovascular disease or diabetes participated, but only 119 participants completed the intervention at 82% of the low-fat group and 79 in the low-carb group. The intervention was a low carbohydrate or low fat of daily energy intake from total fat diet. The measurements were collected at 0 months, 3 months, 6 months, and then at 12 months. In conclusion, the low-carb diet was more effective for weight loss and cardiovascular risk factor reduction than the low-fat diet in obese Black and white adults. So for people who want to lose weight and reduce their risk for cardiovascular disease, restricting carbohydrates would be an option for their diet, although further studies are suggested.